Okay. Eicosanoids. Lots and lots of good stuff here with this. Before we jump into the actual questions, let's run through. We'll try and run through this document really quick. Just kind of give us. I know you've said that you haven't talked about or really gone over this a whole lot. So eicosanoid metabolism, kind of building eicosanoids. When we talk about eicosanoids, we're going to be focusing in kind of on immune system type stuff. So we have our prostaglandins, thromboxanes, leukotrienes, and lipoxins. Thromboxanes, those are our the thromboxanes. Just going to double check, make sure I don't say something dumb. Yeah, these are our, it's a substance. These are made by platelets. It's kind of our clotting type stuff. Prostaglandins are going to be what one of our immune cells deals with, kind of inflammation type stuff. Leukotrienes, leuco, meaning white. These are kind of some of our white blood cells. And then lipoxins. I don't remember exactly what lipoxins do. Lipoxins, they promote the resolution of inflammation. So they're trying to stop and fix inflammation. So the eicosanoids, there are 20 carbon atoms, and we'll call them eicosanoid fatty acids. So they're based off of fats. So they function as local hormones, which means they have a big effect over a short period of time because they're localized. It's a reminder of paracrine versus autocrine. So we have lots of stuff. So we have inflammatory responses, pain, fever, blood pressure regulation, bronchoconstriction, bronchodilation, blood clotting, all this kind of stuff are controlled by our eicosanoids. Here's the big key point. All of our eicosanoids are derived from arachidonic acid. All of them are. So arachidonic acid is our base. That's going to be asked 1,000 different ways. And it's important to understand that our body actually cannot produce arachidonic acid. You'll also see arachidonate. It's a long chain fatty acid ion resulting from the removal of a proton from the carboxy group of arachidonic acid. And here's where we're going to be getting this from. Do you remember previously we were talking about fats and we looked at which fats we needed to know the name of? Linoleic or aka linoleate was one of were those, right? Remember linoleic acid? Seeing that in our
during the biosynthesis of fatty acids, right?
Yeah, during biosynthesis of fatty acids, that was one of our important ones. So it is an essential polyunsaturated omega-6 fatty acid. The dietary linoleate, aka linoleic acid. Linoleate is just the salt or the ester, so like the storage form, essentially is a binded form of linoleic acid. So it's we get arachidonic acid from linoleic acid. Okay. Definitions, all this sort of stuff from linoleate to the different steps. It gets desaturated, giving more double bonds. Then it gets elongated because it starts off at 18, so it needs to go to 20. And then it gets desaturated again to give us more double bonds to give us the arachidonate, which goes into arachidonic acid. Let's see. Okay, so all this through, there's a lot of big names in here. So it's important, we start to slow down a little bit and read, because a lot of these names are pretty long, pretty gross. So we just want to make sure that we can say them out loud. So So just here, the arachidonic acids are going to be esterified at the 2 carbon of the glycerol backbone of the phospholipids. Remember we talked about phospholipids, glycerol. Think about like the triglyceride and how that's all shaped and stuff. We have the glycerol portion. And then at the very bottom, we have like 2 fatty acids attached to it. And then a phosphate group at the bottom. Okay, so names now. Phosphatidyl inositol. Phosphatidyl inositol. It's a phosphatidic acid combined with inositol, or inositol, however you pronounce it, found in the biomembranes and a precursor to certain cellular signals. There's also phosphatidylcholine, aka lecithin. Okay, phosphatidylcholine. We have that prefix phosphatidyl. You really just need to know, if you can remember phosphatidyl, remember the difference between the base, the suffix inositol or versus choline. Okay, which is a phospholipid linked to choline. So back again, remember arachidonic acid, pretty much the same thing as arachidonate. A lot of the times, like we can like glutamate versus glutamic acid, like they're essentially the same thing. Linoleic acid or linoleate, they're the same thing. Okay. Those get converted to the arachidonic acid or arachidonate. And then we have these different phospholipids that we'll look at in a little bit. Okay. Some random questions will come back. I think this part, we're going to start getting into this with questions. So I just gave you kind of the intro, the first big chunk. Let's start getting into questions. And as we come across questions, we'll dive into what the arachidonate, like how we use it to make the eicosanoids. Okay. And I'm not going to, I know that this has become a back burner. So for the first, let's say the first 10 questions, we're just going to start by kind of reading the question, breaking down the question, looking at what the different words are, what things mean, and then just going over the answer, because I don't want anybody, just killing their brain right now trying to answer these questions that I know we have not been, that we've been back burning. Okay. Does that sound fair?
Yes.
It's good to me.
Sounds good.
Hydro. Okay. Five hydroperoxy eicosanoic acid can be used to synthesize which of the following? So let's kind of go through each of these really quick so we know what's going on. Good old, my favorite thing in the entire world, Google is going to help us. Tetrahydrofolate. When we talk about tetrahydrofolate, this is going to be, it's a cofactor. My brain is immediately going, yeah, derivative B9, that's what it is, B9. So this doesn't really have a lot to do with our eicosanoids. This is a throwaway answer. So this is B9 vitamin cofactor. So don't worry about that. That's not really what we're going to be after. Leukotrienes. Remember, leukotrienes are going to be some of our white blood. Leuko meaning white. Trienes, these are part of our immune system. Their function is recruitment and activation of immune cells, especially neutrophils, to sites of infection or injury. When you get to I believe it's try 4, you'll take lab diagnosis. And you get pretty deep into all of the different kind of, you also do a little bit in Gen Path next trimester, all of the different types of immune cells and kind of what percentage of them. Neutrophils are our kind of general, those are our big bacteria fighters. So if you ever see somebody has a high neutrophil count, typically bacterial type infection. Leucine is going to be one of our amino acids. So answer is not going to be that. And carbamoyl, phosphate, synthesis of arginine and pyrimidine, removal of ammonia, and production of carbamyl groups for many chemicals and phosphate groups for ATP production. We've had carbamoyl phosphate mentioned before, but not really super recently from what I can remember. So in this case, leukotrienes, that's the only one that's really centered around eicosanoids in general. Let's see what we'll just do a little bit kind of where it's located. So as part of, there's a couple different pathways when we're producing eicosanoids. You'll see lipoxygenase pathway, and then you'll also see the cyclooxygenase pathway. They operate slightly differently. We'll get to kind of what those pathways actually are, what they look like as we keep going. But the arachidonic acid gets acted on by a lipoxygenase. Remember, ACE means it's an enzyme. So lipo meaning fat, oxygenase, so it's a fat and oxygen enzyme. And then we have this, our other enzyme, the hydroxy, blah, 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 a whole bunch of big long words. You should probably try to learn how to pronounce this just so that it sticks in your brain a little bit better, but it hurts my brain right now, so I'm not going to do it. It gets, so arachidonic acid gets turned into, this 5-HPETE in order to continue down the pathway to get turned into the leukotrienes and lipoxins. I know you'll probably have like random questions all over the place. Just try and stick with me as we get through more and more questions. We'll cover a bunch more of the material. Okay. Okay. Next question. 5-lipoxygenase is responsible for the biosynthesis of which of the following? So we actually just read this. Our lipoxygenase, the arachidonic acid gets acted on by a lipoxygenase. So that again is our leukotrienes. I mentioned this briefly. Does anybody remember what the function, what leukotrienes do? What's their job?
Recruitment of neutrophils.
Good, yeah. The recruitment and activation of immune cells. We mentioned thromboxanes briefly as well. Do you remember what thromboxanes do? Thromboxanes are, if you've ever heard of thrombocytes, thrombocytes are another name for platelets, so blood platelets. So thromboxane. Also think like we're thinking immune system. Immune system is either with like infection, with some type of invader, or some type of injury. So kind of along those lines, that's where we're looking at. So logically thinking, we're heading down that pathway. So thromboxane is with platelets. What's the job of platelets in the blood?
Clotting.
Yeah, so our thromboxanes are responsible for clotting. Come here, bud. Come here. Is it bedtime? Oh. You want to say hi? Nice. I love you. Mwah. Mm. Yeah. Go get mom. You want milk? No, he's saying vitamin. Oh. Okay. I love you, bud. You need any more dad hugs? Oh, did you hear that? Okay. Mwah. I love you. Oh, you're so cute. Okay. Continuing down the questions. Aspirin. This is a little bit more of a specific question. This question more than likely will be asked on the test. Dr. Sarkar seems to like aspirin questions. Aspirin. Boom. Here we go. So aspirin is one of our NSAIDs, a non-steroidal anti-inflammatory drug, like aspirin, ibuprofen. I knew how to pronounce that at one point. They're going to, they're essentially their job. We have these pathways that go through and produce our inflammatory stimulating cells, you know, those prostaglandins, the kind of stuff that excite and cause inflammation to occur. So what aspirin and these other medications do is actually go in and bind onto the enzymes that are allowing those reactions to occur, to actually stop them in their tracks, to prevent the formation of that end product that goes and stimulates inflammation. So aspirin, for example, aspirin, its job, it's going to do the arachidonic acid to the thromboxanes. And if we pause and we think about this, most of the time when you hear somebody, you know, who's taking baby aspirin, or like takes a baby aspirin a day, this is for Kristen, for you, kind of paramedic background. Typically, what kind of medical condition have they had in the past?
Cardiac or DVT.
Yeah, some kind of cardiac event, oftentimes heart attack, or maybe like some kind of stroke, deep vein thrombosis. Maybe they've had some kind of thrombus or embolus, some kind of clot. So aspirin, in that context, what is aspirin doing? What does that baby aspirin do for somebody?
Acting as an antiplatelet.
Mm-hmm. It thins, also known as an antiplatelet or a blood thinner. So aspirin thins the blood because it blocks the thromboxane. So if we think about it from that side of things, from previous knowledge coming into here, aspirin is typically connected, you know, to like our thromboxane type pathway that we're looking at producing those thromboxanes. Does that make sense? How we got there?
Yes, sir.
Good. Okay. Biosynthesis of which of the following molecules uses the lipoxygenase pathway? Here's the question I was waiting for. Let's actually go over the lipoxygenase pathway. So we want to form the leukotrienes and the lipoxins. And I made this note. We only really need to talk about leukotrienes because in reality, like leukotrienes, that's the only thing that he ever really tested us on. So we didn't really ever talk about lipoxins, except for that they were also there. So main focus is going to be the leukotrienes. So the arachidonic acid, real quick, arachidonic acid comes from what essential dietary acid that we have to eat?
Linoleic.
I want you to make sure linoleic.
Yeah,
Okay. Linoleic acid. I just want you to make sure that you know that name really, really well and how to pronounce it clearly, like all the sounds and stuff, because later on there's another acid that sounds very, that's pretty similar to that. That's also an essential fatty acid that oftentimes you can get really confused between the two of them. So, okay. So the arachidonic acid is going to undergo lipoxygenase reactions. That's why it's called the lipoxygenase pathway, to give us different leukotrienes. Lipoxygenases are dioxygenases that catalyze or help occur the formation of corresponding hydroperoxides, a lot of big words, from polyunsaturated fatty acids such as linoleic acid and arachidonic acid. So basically, it adds the double OH groups onto different parts of the molecule. Okay. So step by step, the arachidonic acid, which we start with, gets acted on by a lipoxygenase. Specifically, what's the name of the one, the specific one? That 5-lipoxygenase. And it turns it into the HPETE. And then that guy gets acted on by another lipoxygenase, another 5-lipoxygenase. And it forms either hydroxy-eicosanoic acid or a leukotriene A4. We're going to start to get into like lots of leukotriene and then like numbers and stuff. These aren't super important. There's a handful that do come up as important. We'll see those in the questions. And if I'm not mistaken as well, there should be some kind of little graph or something in the book that kind of picks out a couple of the important ones, if I'm not mistaken. Once it's turned into the leukotriene A4, you can see the leukotriene A4 is like the father of all of the leukotrienes, or the mother of all leukotrienes, however you want to say it. From leukotriene A4, all of our other ones, the B4, C4, D4, E4, all the rest of them are going to be formed. Okay? So he has in his slides, is this the same? Does he still use these exact same slides? If you've looked at them.
I believe he does.
Okay. Remember, these are like the one slides that are like a funky different color from all the other ones. So, yeah. So biggest things to remember here, this actual process that we have lipoxygenase, our 5-lipoxygenase is what's acting on stuff. Forming leukotriene A4, and then that breaks off into other things. In the slides, he'll actually show you like the LTB4 and which ones do different things. So, and like the functions of all of those kind of stuff. So, okay. Back to this question. Biosynthesis of which of the following molecules uses lipoxygenase pathway? From what we just reviewed, what's the correct answer?
Leukotrienes.
Yeah, the leukotriene A4. Yep. You can freeze it. Thank you. Okay. Next question. Does aspirin have antiplatelet effects? We already answered this. Yes, it in fact does. We talked about it blocks the arachidonic acid to thromboxanes pathway. Eicosanoids are derived from which of the following precursors? Hopefully I've said this word enough times that you guys can remember this one.
Arachidonic acid.
Yeah, our arachidonic acid. Another part of arachidonic acid that you'll see, and we'll probably see this a little bit later on, oftentimes the membranes are like our phospholipid bilayer membranes that we have are made up of fatty acids and stuff, are made up of obviously those phospholipids. So those phospholipids are going to get pulled out of those membranes when they're needed, converted into arachidonic acid, and then used to make eicosanoids. Okay. Or like if you think about cell damage, if a cell gets damaged, like the first thing that it's really going to get damaged of a cell is the membrane. So if we have damaged cells, we have bits and pieces of the membrane around that we can pull these from and synthesize there close by all of these different inflammatory factors. So how does aspirin modulate the activity of the cyclooxygenase enzyme? Let's find our cyclooxygenase pathway. All of our prostaglandins. Okay, so we're going to go through the whole process. The short version, the really short version, is that aspirin is going to inhibit the enzyme prostaglandin H2 synthase. Okay, so that's kind of where we're going to look, and why that enzyme is important. So we're going to go through the whole process to then find where that enzyme is. So, cyclooxygenase pathway. So there's actually two different types of cyclooxygenase pathways, okay? There's a naturally occurring, which we call COX-1, which uses prostaglandin H2 synthase 1. And this is a continuously expressed enzyme, meaning that it's always on or active to some degree. So the COX-1 pathway is always active 24/7, just at varying degrees. If there is no like damage or issues going on at the time, or like nothing serious, it's just active to a very small degree. If there's something big that happens, then obviously it's going to be way more active. And the goal of that is to provide homeostasis. Homeostasis, what does the word homeostasis mean?
Balanced.
Good. Everything is balanced. Okay, so that's the naturally occurring COX-1. And then we have the inducible form of the COX-2, aka prostaglandin H2 synthase 2. This is expressed primarily in diseased conditions, so we have lots of pathology stuff going on. I just hit Control N instead of Control B. There we go. It can also be expressed in response to inflammation and mitogenic stimuli. Mitogenic means any like non-specific stimulants of immune cells. So there's something that's stimulating immune cells that's like not like pinpoint, like that's what's actually causing it. Okay. So step by step. Make sure that I didn't miss something else that's going to be important. Up above. Phospholipase A. Way up here, there's something important about it. Okay, we'll run through this first. So the arachidonic acid is present in the membrane phospholipids. I mentioned that earlier. They're released from the membrane lipid bilayer through the activation of membrane-bound phospholipase A2 or phospholipase C. I believe, if we remember, think back a little bit, when we were talking about like beta oxidation and other stuff like that, we talked briefly about those phospholipases. Like, does this picture or something like this picture look a little bit familiar?
Vaguely, yes.
Yeah, if we go back a little bit in our biochemistry book, I think, was it in the very first lesson? Let's see if I can find it without chapter 2. So many pictures. Man, I really wish I could search this book, but I know it was here somewhere. Oh well. Anyway, these couple of these, like these different numbers, there's different phospholipases. There's phospholipase A, B, C, and D, and they slice and they dice different bonds within our phospholipid. Here's our phospholipid, our glycerol backbone, our fatty acid chains, and then our phosphate group, in this case phosphoinositol, right there. So a phospholipase is an enzyme that hydrolyzes lecithin or a similar phospholipid. The phospholipase A2, it hydrolyzes the acyl group at the C2 position of the phospholipids. And the phospholipase C hydrolyzes, or hydrolyzing is hydrosis. That's using water, putting in water to break bonds. And it does it to form something called DAG, which diacylglycerol right here. Diacyl is the fatty chain. Glycerol, here's our glycerol backbone. 2 acyl groups and a glycerol. DAG, which contains the arachidonate attached to it at carbon 2. So the second carbon right here is our arachidonate. And then we also get a phosphoinositol on the side there. Okay. This is some explanation of exactly how all of that goes down. Let's go back to our Cox reactions. So we have calcium-dependent cytosolic phospholipase A2, CPLA2. So this is our enzyme. So an intracellular calcium levels increase due to different types, due to inflammatory mediators. So due to inflammation, we're going to get an increase in calcium in the area. And so this is going to be what's responsible for the release of the arachidonic acid into the cytoplasm. That's first step. That phospholipase A is going to clip those different chunks, give us, our DAG, and give us the phosphoinositol, and then it's going to continue to break stuff down to give us that arachidonic acid. The Cox enzyme, the Cox enzyme has a bunch of AKAs, so we'll see them as we go through. So Cox enzyme, aka prostaglandin endoperoxide synthase, has a cyclooxygenase enzyme activity and a peroxidase enzyme activity. The cyclooxygenase part acts on the arachidonic acid and turns it into prostaglandin G2, so it turns it into a prostaglandin. What was the job of prostaglandins again? Do you remember?
Don't remember.
Okay. The prostaglandins, oh, I didn't put it up here. Prostaglandins are inflammatory encouragers. They encourage the inflammatory process. So they increase inflammation. So that cyclooxygenase part turns the arachidonic acid into the prostaglandin G2. So here we have arachidonic acid getting acted on by cyclooxygenase. And that oxygen part means that the reaction requires 2 oxygen molecules. It's putting oxygen and attaching it onto this to turn it into the prostaglandin. Second part is a peroxidase part, which then acts on the prostaglandin G2 and turns it into PGH2. I don't remember what PGH2 is, like prostaglandin H2, I think is something. It's I want to say it's prostaglandin hydroxide or hydroxyl something, but I don't quite remember. We usually just refer to it as PGH2. So PGH2 is going to be our main precursor to all of our other prostaglandins, another thing called prostacyclins, and thromboxanes. So this is our, from arachidonic acid to PGH2 is our first big step. PGH2, and then we have our different, this is where we can split off into all of our different things to make prostacyclins or to make thromboxanes. Let's continue to find, so aspirin, how aspirin modulates the activity of the cyclooxygenase enzyme. Sorry, our enzyme, the prostaglandin H2 synthase, and here it is AKA cyclooxygenase, AKA COX enzyme, AKA prostaglandin endoperoxide synthase. So that whole process that we were just talking about, where our, I should add in here as well, AKA prostaglandin H2 synthase. This whole enzyme that's doing these 2 steps, it's the same enzyme that does both of these steps. The enzyme that's doing both of those steps is where the aspirin is actually blocking and stopping it from happening. So we never get the formation of PGH2. So we never get the formation of all of these other guys down here. I just talked a lot and said a lot of words. More or less, did we follow kind of what I was talking about? And there's a lot of big words, big names, but more or less, did we follow?
Pretty much.
Okay.
For the most part.
Okay.
Tried my best.
Yeah. At the end of the day, you know, it's going to be kind of come back in through this, kind of go through it step by step and look and see, okay, this goes to this, goes to this, goes to this, and just really similar to glycolysis Krebs cycle, kind of drawing it out. of saying, okay, this then goes to this and does so and does whatever is going to be one of the best ways to really kind of start to lock this stuff down. The key thing to remember in this is remember like the most important stuff, like the PGH2. Remember the in like the lipoxygenase pathway. Remember the HPETE, that super long freaking word. Remember the arachidonic acid. Remember the linoleic acid, that kind of stuff. Those key components. Okay, so aspirin modulates activity of the cyclooxygenase enzyme. Let's try and answer this question now. By dimethylation of the hydroxyl group of the methionine residue of the enzyme, by acetylation, and we didn't actually get into this specific part of it, so I'm just going to leave the answer. So this is by acetylation of the cerl hydroxyl group of the enzyme. And I believe, let me look, aspirin. That's fine. Actually, I will mention that real quick. This is usually a test question. Salicylate is the same thing as aspirin. 9 times out of 10, that's a test question that he'll ask. But so more specifically, we know that it blocks that COX enzyme. But more specifically, it acetylates the cerl hydroxide of that enzyme, which makes it stop working. This next question is also involved talking about the COX pathway. The enzyme PGH synthase. Can anybody tell me one of the AKAs of PGH synthase?
COX enzyme, prostaglandin endoperoxide synthase, cyclooxygenase.
Yeah, cyclooxygenase enzyme. Yeah, all of those good. Good. And it contains 2 different functions. One that uses the 2 molecules of oxygen, and the other which performs a 2-electron reduction. Do we remember what those 2 reactions are? Remember, first one with oxygen. Oxygen, we know it does oxygen, so there's, I guess technically all of these say oxygen, but we look at this question, typically, if this is a test taking strategy, if 2 test questions have at least one similar answer, more than likely the answer is going to be one of those. It's more likely, more often, that's going to be the case. Answer to this one, we have a cyclooxygenase and a peroxidase is what does that. And the picture of that is right here. Our cyclooxygenase goes from arachidonic acid to prostaglandin G2, and the peroxidase takes us to PGH2. I think that this question is probably supposed to have some kind of picture or something with it, but it doesn't. So we're going to ignore that one. Looks like it should have some kind of picture or something with it, but I don't see anything there. Okay. What eicosanoid metabolic reaction involves the enzyme phospholipase A2? Membrane phospholipid to arachidonic acid to membrane phospholipid, arachidonic acid to it's probably supposed to be leukotrienes, or arachidonic acid to prostaglandins. Any guesses?
Is it the membrane phospholipid to arachidonic acid?
Yeah, it is. Very, very good. So we have phospholipase A2. Does anybody remember the name of the other phospholipase that we sometimes use?
E.
Phospholipase C. Good. The phospholipase C. Just a quick review of that. Our phospholipase A2 is going to break off the arachidonate right there. That's where our phospholipase A2 acts. And our phospholipase C is going to break off that head group, which we call the phosphoinositol. So phospholipase breaks off this part to give us the diacylglycerol, which contains the arachidinate, or aka arachidonic acid, here in this second carbon position. And then our phospholipase A2 is going to break off the arachidinate specifically. Good. What happens when eicosanoids bind to their selective receptors? So I'm just going to reveal the answer to this one right here. This one is an all of the above question. So we think eicosanoids, there's a whole bunch of different parts, different type of eicosanoids with different jobs. Let me see. I know a couple saw question 8 on here. I had a question of extra person. Yeah, so the eicosanoids are bind to their plasma receptors in order to elicit their action. And they are, a lot of them are G protein type pathways. But you're gonna have, if we look at this, protein kinase, G protein pathways, adenylate cyclase, all of those, do those all look familiar? Protein kinase, adenylate cyclase, G protein pathways, all three of those, and the calcium actually as well later on is part of it, are our G protein coupled receptors. Right, all of those are part of that G protein coupled receptor. Hopefully we, somewhere in the very depths of our brain, that's sitting back there somewhere. What is one of the functions of prostacyclin? This one will just go ahead. Prostacyclin deals with dilation of blood vessels. Let me see if I can, if I have others in here. Prostacyclins, they're produced by blood vessel walls, and they are potent inhibitors of platelet aggregation. Platelet aggregation, that's just a fancy word for the way that platelets form a blood clot is that they actually essentially link together and they smash all together and they form a big ball of platelets that grabs a bunch of other stuff that helps to block and to form a clot. So prostacyclins inhibit the platelets all sticking together. They also deal with dilation of blood vessels. That's just more of a, like, put prostacyclin, what's their function in a little chart, and remember what they do. What is one of the possible mechanisms by which glucocorticoids regulate inflammation? So what was that?
It's either D or B. I think.
So this one, let me see if I have glucocorticoids on my thing here anywhere. Glucocorticoids, corticosteroids. So remember,
CAX2 inhibitors on the brain.
yeah. So let's look at this. So corticosteroids are used as an anti-inflammatory agent. They inhibit the phospholipase A2 and decrease arachidonate production. So because of arachidonate production, if we decrease arachidonate production, right, all of those eicosanoids that are built from arachidonate that are supposed to be in charge of inflammation, like our prostaglandins specifically, I don't want to get too much into those other extra words. Prostaglandins specifically, If we don't make prostaglandins, we don't activate inflammation. If we don't activate inflammation, we get less inflammation. Corticosteroids, for example, so is any of a group of steroid hormone produced in the adrenal cortex or made synthetically. We're mostly talking about synthetic ones, like the ones that we either take by mouth or inject. We have glucocorticoids and mineral corticoids. You're going to talk about this a little bit in Phys 1, but mostly Phys 2. We hit these steroids pretty hard. But if you've ever heard of anybody getting like, have you ever heard of anybody get like a shot in their low back, like a steroid shot in like the SI joint or in the low back, that kind of stuff?
My mom got one.
Yeah.
The
So,
cortisol shot, right?
Yeah, cortisol. Cortisol is an example. So cortisol is naturally produced in the adrenal glands. We know that it's when we're really, really stressed, our body produces excess cortisol. So high sympathetic nervous system produces cortisol because, if we have high cortisol in our blood, that actually helps reduce a little bit of the pain sensation that we can feel in the short term. If it's long term, then we get other issues. So essentially we take that cortisol, synthetic cortisol that we make in the lab, and we go right to where there's lots of inflammation, and they inject it into that area. That cortisol within that area binds onto and inhibits the phospholipase A2, and the job of the phospholipase A2 is to cut off and to release the arachidonic acid. So if we can't release the arachidonic acid, we can't continue any of the processes to make the stuff that's going to give us inflammation. This tends to be more effective in places like the low back or in the neck when you have inflammation being the cause, kind of thinking about like chiropractic wise, when you have inflammation that is causing compression of a nerve root. If like that's like the specific cause, injections are one of those things that is kind of like a first, like an immediate relief kind of line of care that people will use. Not always super effective, because when you're injecting needles into stuff, it's never great, but and it's never it's not always super specific, depends on who's doing it. Yeah. So glucocorticoids are going to inhibit the phospholipase A2 enzyme. This prevents the release of arachidonic acid. Any questions with that up to that point?
Good so far.
Good. Okay. Question 14. What is one of the possible mechanisms by which glucocorticoids regulate inflammation? Let's go through these one by one. Activation of phospholipase A2 enzyme. We literally just said it inhibits the phospholipase. So it inhibits the phospholipase A2 enzyme. What was the other phospholipase enzyme that we see?
Phospholipase C.
Good. And what does the phospholipase C snip off?
The head group.
Good. Well, what do we call that head group?
Don't remember.
It's a phosphate group, right? So it's phosphoinositol. Okay, so we're not activating, we're inhibiting. Inhibition of the secretion of certain chemotactic factors by the inflamed cells. That's a lot of big words. So inhibiting the secretion, so the release, certain chemotactic factors. That's the tricky word right there. Chemotactic factors. Any ideas or thoughts What do we think chemotactic factors might mean? Any thoughts, any ideas?
Cancer, but
Yeah, that's what I was gonna say. My brain goes to cancer and like chemo
Right.
treatments.
Like chemotherapy, right?
Yeah.
Have anybody you ever seen like what chemotherapy does? Like what it looks like? How they actually like what the medicine actually looks like?
no.
Nope.
Most often chemotherapy is like an IV fluid that they can either be a pill form or they can do an IV fluid and they inject it into you. So chemotaxis or chemotaxis, you'll hear it pronounced both ways, is movement of a motile cell or organism in a direction corresponding to a gradient of increasing or decreasing concentration of a particular substance. Chemotaxis is literally the movement of cells. So in this case, when we talk about chemotaxis or chemotaxis, there are certain factors or certain types of chemicals that get released by injured or inflamed cells. That's kind of like a beacon. So chemotaxis, so the inflamed cells send out, you can call it a beacon, you can call it a bat signal. They send out a bat signal to all the immune system to let them know they need help. So the inflamed cells send out the signal. So cells move, which is the actual chemotaxis, towards that site that needs help. So chemotactic factors is that signal. The specific factors or chemicals that are released that let the other immune cells know, hey, we need some help over here. Like, hey, can you please come and help us out? I like to dive deep a little bit more on that definition because you'll see this word a ton, and I don't feel like anybody ever explained it super well to me. So does that make sense? Chemotactic factors and chemotaxis or chemotaxis.
Yes.
Yes.
Good. This will come back quite a few times. You'll see this pretty often in future courses. So, and actually that is going to be our answer in this case. So the inhibition of those chemotactic factors by the inflamed cells. The next couple of answer choices: glucocorticoids binds prostaglandins irreversibly. We learned that the main way that glucocorticoids they actually stop and prevent. Instead, we'll say they prevent the formation of prostaglandins. They don't bind to them. Activation of the inducible form of cyclooxygenase type 2 enzyme. What would that do? What would happen if we activated the COX type 2 enzyme?
Increase inflammation?
Yeah, that would increase the production of prostaglandins, which would increase inflammation. Good. Cool. What is one of the specific structural characteristics of thromboxane A2, which retains its full functional activities? This honestly is just kind of like a memorization type thing. So it's thromboxane. Thromboxane. Here we go. Thromboxane A2. So a 6-member ring, all this stuff. This is all the stuff that thromboxanes do: vasoconstriction, platelet aggregation, lymphocyte proliferation. Lymphocyte, it's a type of immune cell. Proliferation means creation or dividing, creation of. Bronchoconstriction. So we have our nice little thromboxane down right over here, thromboxane A2. So the specific structure that we're looking at, take a look at our answer choices. Presence of a double bond between carbon 9 and carbon 10. Well, there's carbon 9 and 10, not a double bond there. Presence of a saturated 5-carbon ring. 1, 2, 3, 4. There's a 5 there. With saturated 5-carbon. Saturated means that it has it's covered in hydrogens. So right there, because we have an oxygen there in the middle, that's not it. Absence of a carboxylic acid group. There's our C-double-O-H. Presence of a hydroxyl group attached to carbon 15, 11, 12, 13, 14. Carbon number 15 has a hydroxyl group. This question sometimes pops up just as an answer choice. I don't feel like it. I don't feel like it's super common, but he might throw a question like this on the test. That's honestly more of just like a, hey, memorize this little fun tidbit about thromboxane A2. Okay. What is the mechanism of action of non-steroidal anti-inflammatory drugs, ibuprofen, and acetaminophen? I'll just throw this one in here. Look at the answer. We can talk about kind of what it means, because this is more, again, just more of a memorization type question. NSAIDs, ibuprofen, and acetaminophen, they are reversible competitive inhibitors of the enzyme cyclooxygenase. What does reversible competitive inhibitor mean? What is a reversible inhibitor?
Like when it binds, it can be, basically you can unbind it so that the proper thing can come and bind in.
Good. So when it binds, it can release and allow the enzyme to keep doing its job. Whereas something that was an irreversible inhibitor or an irreversible binder of the enzyme cyclooxygenase, that's going to bind onto that COX enzyme, and it is never going to work again. The only fate that it has, so irreversible means that this enzyme is now trash and has to be essentially scrapped for parts and broken down. Let me see if he gives us any examples of irreversible. Irreversible. Not that I can remember. I don't think he gives us irreversible of specifically the COX enzyme. Yeah, there's our G protein coupled receptor with the calcium, the protein kinase, all that stuff that we saw earlier. Okay. With that big focus, know that our NSAIDs are reversible competitive inhibitors. What is true about eicosanoids? They're synthesized directly from acetyl-CoA. When we talked about eicosanoids in the very beginning, do you remember how many carbons did we say eicosanoids had?
20.
They had 20 carbons. How many carbons does acetyl-CoA have?
16?
I think you're thinking of like palmitic acid.
Yeah.
Yeah, acetyl-CoA. Remember, we have pyruvate. Think glycolysis. We take a 6-carbon glucose, break it down into 2-3-carbon pyruvate. Pyruvate gets broken down into the 2-pyruvate gets broken down into a 2-carbon acetyl-CoA. So acetyl-CoA is 2 carbons. So no shot that we are synthesizing our eicosanoids from acetyl-CoA. Eicosanoids are not sensitive to inflammation processes. They're literally that's their job, is to be sensitive to inflammation processes and do all that stuff. So these last two, there we have our 20 carbons, good. Big difference here, we have polyunsaturated fatty acid or saturated fatty acids. They're derived from, or they are saturated fatty acids. So if we think back, what's the name of the essential fatty acid that gets turned into arachidonic acid?
Linoleic acid?
Yeah, our linoleic acid. And how many carbons does linoleic acid have? It's okay if we don't remember.
Yeah.
Linoleic acid has 18 to start out with. So our linoleic acid has 18 carbons. And it comes from plants, specifically from omega-6s, right? We saw that briefly. And then it gets turned into arachidonic acid, which has 20 carbons. So if we think plants, I usually immediately think plants, like main big plant stuff that we use, like olive oil, that kind of stuff, just comes from plants. Those guys are unsaturated fats. So they are derived from the 20-carbon polyunsaturated fatty acid. Specifically, arachidonic acid has 4 double bonds, which makes it polyunsaturated. We all okay with that?
Yes.
Sweet. Which of the following is true of aspirin? It activates prostaglandin biosynthesis. Aspirin, right? Is that pro-inflammatory or anti-inflammatory?
Anti.
Anti. So it's not going to activate prostaglandins. It activates dihydrofolate reductase. At any point so far, have we mentioned dihydrofolate reductase?
Nope.
No.
Nope. It is a non-steroidal inflammatory drug. It's non-steroidal inflammatory drug. This could get a little bit tricky just because it's missing right here anti. So this is essentially saying the same thing as A, that it promotes inflammation. So it's not that one. So aspirin inhibits cyclooxygenase irreversibly. Okay, and here's our example of irreversible versus reversible. Let me double check with almighty Google. Because aspirin is an NSAID, anti-inflammatory, a non-steroidal anti-inflammatory drug. Okay, yeah. And like we mentioned earlier, specifically, it irreversibly inactivating the platelet cyclooxygenase. So it inhibits formation of those platelets of those thromboxanes. So this one is irreversibly inactivating the platelet cyclooxygenase. Cool. Does anybody remember what the other name for aspirin was? Make sure I spell it right. Salicylate.
Salicylic acid.
You'll see this eventually. I think this is in Farm Talks that this is a test question. They talk about aspirin. Aspirin comes back again quite a bit in a couple of other courses, mostly in Farm Talks, Pharmacology and Toxicology course in trimester 5. You'll see that originally aspirin was used or was discovered in the bark of the white willow tree, and it was used by Native American populations to treat pain. So pretty cool. And aspirin is actually a naturally occurring substance. What would be the effect of acetylation of serine hydroxyl group present in the active substrate binding site of the cyclooxygenase enzyme? So we've actually seen this before, acetylation of the serine hydroxyl group. We saw this in a previous question when we were talking about a specific drug. Does anybody remember what drug we were talking about when we were talking about acetylation of that hydroxyl group?
Acetaminophen.
It was aspirin.
Was it both? Because there was a question about both, but I may be mixing those two up.
I think acetaminophen was an answer choice. But yeah, if we look up the acetylation. How aspirin modulates the activity of the cyclooxygenase enzyme by acetylation of the seryl hydroxyl group of the enzyme. That was the question that we had before. Talking about aspirin. So of these answer choices, remember aspirin, what does aspirin inhibit? It inhibits cyclooxygenase to prevent the formation of what specifically?
Prostaglandins?
Let's think back, use our real world knowledge. Aspirin is used. What does aspirin do to the blood?
Thins it out.
Thins it out. What's responsible for thickening our blood?
Platelets.
Platelets. Another name for platelets is what?
It's not thrombocytes, is it?
It is, yeah.
Oh, okay.
Thrombocytes is another name for platelets. A thrombus. You ever heard that word before? Thrombus?
Yeah, if it breaks off, it causes a stroke, right?
Yeah, so a thrombus is a clot in the vessel, right? Deep vein thrombosis or thrombus. And then if it breaks off, it becomes in, what's it called? An embolus?
Yeah, like a pulmonary embolism.
Exactly. So
People get it from
thrombus. Yeah, so thrombus is a blood clot. What causes clots? Platelets. What are platelets called? Thrombocytes. What's the active thing that they give off to, cause them to clot and do their job? Thromboxane. So thrombo. Just remember that. That's how we get that. And then embolus equals a thrombus that has broken off where it formed and has traveled and is traveling through the blood vessels. So that's why, you know, if you have a deep, like in your calf, a deep, a DVT, a deep vein thrombosis, that's why they get super concerned about those, because it can break off and come back and go into your heart or into your lungs. And that's a big no-no. Okay, so answer for this one, aspirin inhibits thromboxane biosynthesis. Little clinical tidbit. We actually have a family friend of ours who a couple months ago had really intense stomach pains, and she just had these stomach pains for a couple of days. Turns out, and she hates hospitals, hates, terrified of hospitals. So she didn't go to the doctor for over a week until she finally called and finally, like, I think they took her in an ambulance to the hospital. She had a thrombus in her gut. So it had actually blocked the vessels going to a portion of her small intestines. And so she had to have part of her small intestines removed. And as they were doing surgery, cleaning everything out, a chunk of the thrombus broke off and turned into an embolus and went up to her brain and gave her a stroke. So this is the kind of stuff, thrombus, embolus, when you get to trimester 4, try 3 a little bit, but especially try 4, you'll talk a lot more about thrombus and embolus, and kind of how those form, how to recognize if they've formed, and some of the special stuff that goes along with those. Being chiropractors, you probably won't see this a ton, but several chiros that I've talked to, most of them have diagnosed at least 1 or 2 DVTs in their career. So definitely, because it presents a lot like a cramp or like a pulled muscle or something with deep within the calf. So a lot of people will go to like a musculoskeletal doctor because of DVTs. So okay, keep on rolling. Like I said earlier, he likes aspirin. What would be the effect of aspirin during an active inflammatory cascade in human systems? It would inhibit prostaglandin biosynthesis, so it would increase thromboxane biosynthesis. It would be acetylated, or it would decrease the synthesis of arachidonic acid.
A.
Good. Would inhibit the process. The keyword here is active inflammatory, because if it's preventing the COX enzyme, because, you know, we go from our arachidonic acid to our prostaglandin PGG2, then to our PGH2, and then we break off into our thromboxanes. And this guy right here is our COX enzyme. It's going to stop it right there in its tracks, so we don't get prostaglandin. Let me double check that. Actually, I might have put that in the wrong place. Arachidonic acid. I think it's in the right place. It's actually, yeah, it is, because this is actually, technically it blocks it here, technically, because this is all under the same enzyme, so it blocks this whole process. Yeah, blocks both these steps. Then we look at the other answers. It would increase thromboxane biosynthesis aspirin decreases thromboxane biosynthesis, it would be acetylated. Aspirin does the acetylation of the serine hydroxyl group that's on the cyclooxygenase enzyme to turn it off, and it would decrease the synthesis of arachidonic acid. Arachidonic acid would still be being formed, it won't turn into the prostaglandins. Which compound can synthesize the precursor required for eicosanoid biosynthesis? Palmitic acid, linoleic acid, glycerol, or phosphatidylcholine?
Linoleic acid.
Yeah, or linoleic acid. When we say that linoleic acid is an essential fatty acid, what does an essential mean in that case? Kind of like an essential amino acid.
It has to be obtained from the diet.
Perfect, yeah. So anything that's essential equals must be obtained from the diet. Just means means that the body cannot produce it naturally. Good. Which enzyme can release arachidonic acid from membrane phospholipids in order to synthesize prostaglandins? So releasing arachidonic acid from the membrane.
The cyclooxygenase.
So stop. Think
No.
cyclooxygenase.
Phospholipase A2.
Yeah.
Good. The phospholipase A2. The phospholipase, this releases the arachidonic acid. Cyclooxygenase. Remember, it has two different functions, right? There's a oxygenase part and what was the secondary part? The secondary part of that enzyme that it does. Starts with a P. The peroxidase.
Lily butt, come here.
Has a cyclooxygenase part and a peroxidase part. Oh. Thromboxane synthase. What is the chemical or the substrate that's immediately before thromboxane? What gets turned into thromboxane? I would think the pathway, we have two different pathways, right? We have cyclooxygenase pathway and we have lipoxygenase pathway. Which of those two pathways is used to form thromboxane?
Oh, the L pathway. The second one you said.
So our lipoxygenase pathway right here forms our leukotrienes. This is good. This is just repetition, right? Lipoxygenase pathway forms leukotrienes and lipoxins. Okay. Our cyclooxygenase pathway is our prostaglandins, prostacyclins, and thromboxane. Okay. So with cyclooxygenase pathway, we start with arachidonic acid. Our COX enzyme converts that first to PGG2, then converts it to PGH2, and then PGH2 is our base that goes off to form all of the stuff. So thromboxane synthase turns PGH2 into thromboxane. Okay. Which is one of the crucial functions of prostacyclin. We mentioned this briefly. There's another question about this. So the ones that we've talked about, so we have prostaglandins, thromboxanes, leukotrienes, prostacyclins, right? Prostaglandins, remember what do prostaglandins do?
Increase inflammation.
Yeah, they activate or they increase inflammation. Thromboxanes, what do thromboxanes do?
Help with platelet clotting.
Yeah, we call it platelet aggregation is what we call that, the blood clotting. Leukotrienes. Remember, we mentioned these towards the very beginning of today. What do leukotrienes do?
Recruit and activate neutrophils.
Good, and activate. We'll keep it a little bit more general, primarily neutrophils, but immune cells. They recruit and they activate the immune cells, like neutrophils. Prostacyclins. What do prostacyclins mainly do? Let's look at these real quick. Stimulates blood clotting cascades. Which of these does that sound like?
Thromboxanes.
Our thromboxanes, right? So that's probably more of our thromboxanes. Vasoconstriction. If we think about vasoconstriction as well, when we have a blood losing problem, so we are cut, would our vessels want to vasodilate or vasoconstrict at the area where the cut is?
Constrict.
Constrict, right? Because we don't want to be losing that blood. So just like how we stimulate the blood clotting cascades, the thromboxanes also are going to help us with vasoconstriction. Inhibition of thromboxane synthase, that's more like on the side of drugs and stuff, right? That's more of our aspirin that we've talked about. So that leaves us with inhibition of platelet aggregation. What does that mean? Inhibits platelet aggregation?
It inhibits clotting. Thins your blood.
So stops clotting. Good. Which of the following compounds can activate phospholipase A2 in order to release the precursor molecule for eicosanoid biosynthesis? So in what kind of situation would we want to activate making eicosanoids? What needs to be happening in our body for the eicosanoids to activate?
Like injury or illness.
Injury or illness. So based on this list, which of these potentially correlate to an acute injury or illness?
Aspirin?
So aspirin does aspirin cause or treat the illness?
Treat it.
So that treats the illness. So we're not, aspirin is going to prevent eicosanoids from being created. So of the rest of these, what do we think?
Histamine would be my guess, because histamine makes me think about allergies, which is,
Right. Have we ever heard of an antihistamine drug?
yep.
Why would we take an antihistamine?
Allergic reaction, right?
An allergic reaction. Within an allergic reaction, what's happening? What kind of things happen with an allergic reaction?
Inflammation happens a lot.
Exactly. Inflammation. So histamine is one of our communicators and promoters of inflammation. So that guy is going to activate our phospholipase A2.
Hey, 1 second. Is it eosinophils that are shipped to the site when it's an allergic reaction? Or what specific leukocyte is it? I can't quite remember.
So don't worry too much about that. So we have different leukocytes. So leukocytes equals white blood cell, which is our immune cell. We have neutrophils, basophils, eosinophils, and geez, my brain is spacing on the last one.
Monocytes monocytes are a different classification.
Yeah, neutrophils, eosinophils, basophils, technically monocytes as well, and then lymphocytes. We'll include monocytes. Each of these kind of do different things, and this is a little bit above your guys' pay grade right now. This you'll talk about in Try 5 with in your lab dye course. Okay, so like neutrophils is primarily bacterial. Eosinophils you'll learn are especially high in allergies or parasites. Lymphocytes are for viral infections. Those are the three big ones that I remember off the top of my head. Let's see, basophils. What are basophils? I think it's...
I know we have the least amount of basophils, I thought. But I can't remember what they do.
Yeah, basophils. All of these do the exact same thing. Essentially. Their job is to target and to destroy things that are invading us. It's just each of them are a little bit specialized to do what they need to do for different types of things. Because, like parasites have different chemical makeup than bacteria. And, bacteria have different chemical makeup from viruses. Like bacteria, they have a whole cell wall, they have a membrane, and they have organelles and all that kind of stuff, whereas a virus doesn't have all that kind of stuff. A virus is just essentially a DNA injecting machine. That's all a virus is. So each of these have different jobs in being able to recognize and treat and attack different things that could infect us. Don't worry too much about this right now. You'll see, you see these words, neutrophils, lymphocytes, eosinophils. Know that they are white blood cells. They're part of the immune system, but you'll get into each of them all individually later on down the road. So just trying to get too far ahead of yourself, okay? Is that fair?
Yes.
Yeah. You'll get there, I promise. Baby steps, though. Baby steps. Okay, which of the following compounds can release arachidonic acid? What do we think? Membrane-bound phospholipids, corticosteroids, acetyl-CoA, or thromboxanes?
Corticosteroids?
Let's think. Corticosteroids. What are corticosteroids? What are they?
Supercharged anti-inflammatories.
Yeah, they're anti-inflammatories, right?
Mm-hmm.
If we have an anti-inflammation, something that is anti-inflammation, is that going to increase or like want our body to release more arachidonic acid, or is it going to decrease the amount of arachidonic acid?
Decrease.
Decrease.
Yeah, so it wants to prevent the release of arachidonic acid. So we're looking for one that can release arachidonic. So it's not corticosteroids. Acetyl-CoA. Does acetyl-CoA have any impact on actually releasing arachidonic acid?
No.
No. Thromboxanes, right? If we're making thromboxanes, do we need more arachidonic acid or do we need less arachidonic acid?
Less.
If we need thromboxanes.
Oh, yeah, then we need more.
We're going to need more, but it doesn't necessarily cause the release of arachidonic acid, right? So arachidonic acid turns into thromboxanes. So arachidonic acid turns into thromboxanes, but the thromboxanes don't have anything to do with the actual release of arachidonic acid. So the following compounds specifically can release arachidonic acid: our membrane-bound phospholipids. Because remember, we have those two phospholipases. Phospholipase. What were those two again? There's phospholipase. What were those two again?
A2 and C.
And C. What does A2 release?
That would be this one. That would be the membrane-bound phospholipids, right?
Yeah, it releases the arachidonic acid from the, they call it the DAG, the diacylglycerol. Remember that guy? And what about the phospholipase C? What does that do?
It releases the head group, the phosphoiso something or other.
Phospholineitol.
Yeah, that one.
Good. Phospholi. Something like that. Whatever. So I'm not an English major. Okay. Good. Good. Which of the following compounds, actually, take a step back real quick. This question right here is always on the test. Something in this, some kind of form. So just want to be super, super clear. Arachidonic acid comes from membranes of cells. So look for those words together. If you see like where arachidonic acid comes from or releases from, releases from, anything like that, think membranes. Okay, because that'll be in some format, that'll be a question on the test. Okay. Which of the following compounds could be an activator of phospholipase A2 during eicosanoid biosynthesis? This is pretty much a repeat question. Which of these are gonna? Yeah, or histamine. This guy, the hydroxyperoxy blah 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 toanoic acid. What's that guy? Where did we see that before?
That's the HPETE, but I don't remember where that
Yeah,
is
that's
from.
part of the lipox, how would you say it? Lipoxygenase pathway. Lipoxygenase pathway. The lipoxygenase pathway helps us create what? We're creating two different things.
The leukotrienes and I don't remember the other one.
Lipoxins. Good. The 2L. Lipoxygenase has the 2 L's. Lipoxygenase with an L has the leukotrienes and the lipoxins. Which of the following compounds in the eicosanoid biosynthetic pathway synthesizes thromboxane A2? So this is saying, where does thromboxane A2 come from?
Prostaglandin H2.
Good. What's the name of the enzyme that converts prostaglandin H2 into thromboxane A2?
Perioxidase?
It's less complicated than that, okay? So whenever we're making something, an enzyme that makes something, we usually call a synthase, right? So it is literally the thromboxane synthase enzyme. So the thromboxane synthase enzyme acts on the prostaglandin H2 to synthesize thromboxane A2. Cool. Which of the following compounds is a nutritionally essential dietary source of arachidinates in humans?
C.
Yeah. Are linoleate. Linoleate, linoleic acid, same thing. Which of the following compounds is the precursor of eicosanoids?
Arachidonic acid.
Yeah, arachidonic acid. Which of the following drugs is an irreversible inhibitor of the enzyme cyclooxygenase?
Aspirin.
Good. Aspirin. What are some examples of reversible inhibitors?
Ibuprofen. That was the acetaminophen. There's both of those.
I either spell it, whatever, who cares? Do you guys remember the name of aspirin? What aspirin is called? What's its more sciencey name?
Salicylate? Yeah, something like that.
Salicylate.
That one.
Salicylate. I'll write it in here again. Salicylate. Typically, what he'll do is he'll give you this kind of question, and he'll give you these 3 drugs: ibuprofen, fluorouracil, whatever, calcitrol, and then salicylate. And you look at those, and you're like, it's aspirin. It's none of these. Salicylate is aspirin. Which of the following eicosanoids activates platelet aggregation?
C.
Good, thromboxane. If I change the question and asked you about which of the following inactivates platelet aggregation, what would you say?
B.
Prostaglandins. What do prostaglandins do?
Start the inflammatory process.
Yeah, they increase inflammation, right? So it's not that one. We're going to go with our prostacyclin. These guys inhibit platelet aggregation. Next question, which of the following eicosanoids can cause dilation of blood vessels? Let's take this a step back real quick. Which of these were the ones that caused constriction of blood vessels?
Was it the prostaglandins that did it?
So again, let's think about prostaglandins increase inflammation, right? When somebody has inflammation, like let's say I sprain my ankle and my ankle's inflamed, what will my ankle look like or kind of feel like?
Squishy.
Squishy, puffy, right? So inflammation itself vasodilates, causing more blood to rush to the area because we want more fluid there to help clean up all of the broken gunk and to carry the broken gunk away and to help bring more nutrients in to help rebuild stuff. So our prostaglandins, these guys are our pro-inflammatories. So pro-inflammatory, and that equals vasodilation. So I should clarify, they're pro-inflammatory, so they activate stuff. Which eventually, I should say, which eventually causes dilation, vasodilation, but that's not their primary objective. Also, remember, when you're looking at a multiple choice question, if two answers like prostaglandin A2 and prostaglandin G, if they're both like prostaglandins, or it's like thromboxane this, thromboxane that, most often if you have two answer choices that are essentially the same, it's probably not one of those. Just test taking strategy. So dilation of blood vessels, thromboxane, we just said, causes vasoconstriction. So our answer is going to be the prostacyclin. Essentially, prostacyclin is the opposite of thromboxane. So while thromboxane causes vasoconstriction, prostacyclin is its opposite and will cause vasodilation. I got a little bit carried away with the prostaglandin stuff. Hopefully, though, hopefully I cleared it up. Does that make sense?
Yeah, this chapter's just throwing me for a loop.
Yeah, this chapter, I don't love the eicosanoid stuff just because there's a lot in here. A lot of names that are like names of stuff that are very similar to one another. So it helps to kind of like what we've been doing, like when we wrote them out here, like what each one does. It helps to actually type it out or write it out yourself. So that way, you know, your prostaglandins increase inflammation. Prostacyclins. And you can even look at this. Glands get swollen inflammation. Cyclins, cycle clot. Prostacyclins deal with clotting or stops clotting. Any kind of way to just, you need to repeat it kind of over and over and over again until it bangs its way into your long-term memory. Which of the following eicosanoids contains a saturated 5-carbon ring? This is more just a straight memorization one. It's our prostaglandins contain the 5-carbon ring. Which of the following eicosanoids inhibit platelet aggregation? Same logic as that previous question. Which one would inhibit the platelet aggregation?
The prostacyclin.
Mm-hmm.
Good, the prostacyclin. Which of the following eicosanoids is a powerful vasoconstrictor and initiates platelet aggregation?
Thromboxane.
Yeah, thromboxane A2. Which of the following enzyme system pathways produce lipoxins?
The lipoxygenase pathway.
Yeah, lipoxygenase pathway. Perfect. What else does the lipoxygenase pathway produce besides lipoxins?
It's the other
Also,
L.
it also starts with an L.
The leukotrienes.
Good. Yeah, the leukotrienes. Which of the following enzymes catalyzes the formation of prostaglandin H2 from its precursor? So look at this.
It's the COX enzyme, right? So it would be the that one, cyclooxygenase.
Good. Remember, because our lipooxygenases are part of the lipoxygenase pathway, and those don't form prostaglandins. Those form the leukotrienes and the lipoxins. And thromboxane synthetase acts on the prostaglandin H2 to form thromboxanes from our prostaglandin H2. Question 38. Which of the following enzymes could be the target for aspirin during eicosanoid biosynthesis?
I want to say cyclooxygenase
Why? Let's talk about it.
because you want to stop the prostaglandins from causing the inflammation. So it's gonna stop the COX enzyme so it doesn't produce the prostaglandins.
Good. Because if we produce the prostaglandins, those prostaglandins eventually turn into what? What's the next step that we kind of focus on with aspirin? What else does aspirin prevent the formation? Or what else does aspirin stop from forming? Cameron, do you know?
Sorry, this is kind of separate. I sent you a message on Teams about your notes. I just don't know if you'd be able to check
sorry.
that later.
Yeah, I did get it.
Okay, but no, I don't know the question 38.
I'll shoot you a message back in a second, okay?
Okay, appreciate it. Thanks.
Okay. So we think aspirin. Well, I'm just going to keep bringing this back. Aspirin prevents blood clots because aspirin messes with platelets, the thromboxane, so stops thromboxane. Thromboxane is part of the cyclooxygenase pathway. Okay, question 39. Which of the following enzymes in the eicosanoid biosynthesis possesses two separate enzyme activities?
Is the prostaglandin endoperoxide synthase, is that one?
Good. What's another name for that super long, confusing name?
Is that the COX enzyme? Hang on.
Yeah, it is. It's the COX enzyme.
Okay.
They just give it the other funky name, the prostaglandin endoperoxide synthase enzyme. Cameron, I just messaged you back as well. So. Ooh. Accidentally highlighted. I don't know why that's highlighted down there. I don't think that I did that. Maybe I did. I don't know. Which of the following enzyme initiates the synthesis of leukotrienes? So we're talking about leukotrienes, right? So is that our lipoxygenase pathway or our cyclooxygenase pathway?
Lipoxygenase.
Lipox.
Yeah, so immediately cyclo and our peroxidase, those guys gone. So now we're left with these 12, 5, and 15 lipoxygenase. This is just down to remembering what it is. It's our 5 lipoxygenase enzyme. Which of the following essential fatty acids is required to synthesize eicosanoids in mammals?
Linoleic acid.
Linoleic acid. Hopefully that's been beaten into you at this point. Which of the following is true? Eicosanoids bind to their plasma membrane receptors in order to elicit their action, or eicosanoids bind to their nuclear receptors in order to elicit their action.
Plasma.
Wait, what was that?
The plasma membrane receptors.
Yeah, you remember way back in the very, very beginning of everything that we did, we talked about what kind of coupled receptors do our eicosanoids use?
The G protein.
Yeah, our G protein coupled receptors. And those are our plasma membrane receptors. Just for kind of recall purposes, nuclear receptors. What are nuclear receptors?
The receptors that are located in the nucleus of the cell.
Yeah. What kind of things use the nuclear receptors? What are some examples of chemicals that use nuclear receptors?
Is insulin one of them? I don't know if that's right though.
Insulin is not. Insulin uses.
Tyrosine kinase.
Yeah, thank you. That's what I was looking right at you.
I knew you were going there.
Insulin uses tyrosine kinase. Nuclear receptors are some of Dr. Sarkar's favorites. Those are our thyroid hormones, our steroid hormones, those kind of guys. Those are nuclear receptor hormones, okay? But our eicosanoids use our plasma membranes. Okay. Which of the following isoforms of the prostaglandins is the substrate of the enzyme thromboxane A synthase? So essentially, which of these is the stuff that the thromboxane A synthase works on to form thromboxane? A2.
PGH2.
Good. PGH2. What turns into PGH2? So what's the precursor to PGH2?
The PGG2.
Good. And what's the precursor of PGG2?
The arachidonic acid.
Good, arachidonic acid. What's the name of the enzyme that turns arachidonic acid into PGG2?
It's the COX enzyme.
Good. And what's the name of the enzyme that does PGG2 to PGH2?
Is it's a COX enzyme too, right?
Also the COX enzyme.
I'll say it's
because
also
remember the COX enzyme has 2 enzymatic properties. What are those 2? The first one is a cyclooxygenase. And what's the other one? Starts with a P.
Is it the prostaglandin H2
Simpler,
synthase?
simpler. Way simpler. It's a peroxidase. Okay.
That's right.
Yeah, our cyclooxygenase and a peroxidase. Almost there, you guys. Which of the following pathways is involved in the synthesis of leukotrienes?
Lipoxygenase pathway.
Yeah, good. Which of the following is involved in the synthesis of lipoxins?
Also lipoxygenase pathway.
Yeah, because our L's. Which of the following reactions can inactivate thromboxanes? This one isn't super clear, kind of gross. Reduction of the double bond at carbon 13. There's probably something in the book that's specific about that. That's probably a question that I would, flag and just review that one right before the test, in my humble opinion, in case like that specific one decides to pop up. Okay. Which of the following reactions would inactivate thromboxanes? This one's kind of, again, another one of the just right before oxidation of 2-hydroxyl group to a ketone. Some of these, I'm sure there's little bits and pieces in the book of like why this is, but I don't remember these questions really being a big thing. So, like I said, I would review these right before the test, and pray that they're not on it because they're more raw memorization-y kind of gross type questions. Okay. Which of the following sentences is true for I should say glucocorticoids. It's not glucocorticoids, glucocorticoids. Excess secretion of glucocorticoids can decrease arachidonic production. Glucocorticoids can enhance inducible cyclooxygenase 2 activity. Glucocorticoids activates phospholipase A2. Are glucocorticoids pro or anti-inflammatory?
Anti.
So would they activate the phospholipase A2 and increase COX-2 activity?
No.
No. So what's the answer?
The excess secretion.
Yeah, it will decrease arachidonic production. Which of the following statements is true of thromboxanes? It contains a 5-member saturated carbon ring. I'm going to tell you right now, no, it does not, because it has that little oxygen. Has an oxygen in the middle, so no. It contains a 7-membered unsaturated carbon ring. Heck no. Contains a 6-membered ring containing at least one ether linkage. Yes, it does. That ether linkage, because the thromboxane, it looks like carbon, carbon, carbon to an oxygen, carbon with, wait, I messed that up. 1, 2, 3, boo, boo. 1, 2, 3, 4, 5, 6, something like that. Okay, I'm not a very good drawer. And then it connects with an oxygen somewhere like that. Something like that. Not a very good artiste, but these questions, you just got to see enough of them to understand kind of what it is they're asking. Which of the following statements is true for eicosanoid biosynthesis? Dietary glycine can synthesize, dietary linoleate can synthesize, dietary arginine, or dietary glutamate. Which one is it?
Linoleate.
Linoleate. Which of the following statements is true? Eicosanoids are obtained from cholesterol esters, derivatives of isoprene units, can be produced directly from tryptophan, can be derived from certain fatty acids.
Derived from certain fatty acids.
Yeah, because what's the fatty acid?
Linoleic acid.
Linoleic acid. Which of the following unsaturated fatty acids is nutritionally essential? We've already had this question. It's linoleate. Which of the following would decrease platelet aggregation, increase CAMP, and cause vasodilation? Answer on this one says prostaglandin I2. That's probably one of just like the specific ones he has listed in the PowerPoint. Okay, that's not responding. It's fine. So before test, y'all's test is probably coming up in
Week 9.
week 9. Okay, so 2 weeks.
I think ours is 10.
Okay, if you can, sometime this week, I would try and make it through this material. Go back, review this material, pull out some of these specific guys that he mentions in the PowerPoints and the PDFs, and make a little chart and just highlight the key points of this, throw them into a Quizlet or something to be able to review them. Okay? Blank pathways involved in synthesis of leukotrienes. Leukotrienes is L. Our lipoxygenase pathway is our L pathway. Blank inhibits platelet aggregation. We immediately look at these. Prostacyclins are our inhibitors of platelet aggregation. Blank is an irreversible inhibitor of the enzyme COX. It's been beaten to death. It's our aspirin. Ibuprofen, go away, ibuprofen. It's our aspirin. The ibuprofen, acetaminophen, those guys are reversible inhibitors. And the last question, nutrient-essential dietary source of arachidinates in humans, once again, linoleate. We made it. How do we feel post questions compared to pre-questions?
Pretty decent.
Way better than before.
Okay.
Hanging in there.
So let's do 2 more, right? I'm kidding. I'm kidding.
I was about to say it's a little late.
Yeah, it is late. We got through, what was it, about 2.5 hours to get through all those questions?
Yep.
Not the worst that we've done.
I will say the next 2, I believe, are a lot. I think the next one's like 40 something, and then the ones after that are like 28 and 27.
Okay. Let me go ahead and drop this into the chat so you guys have it.
Appreciated.
Loading, loading, loading.
Is your paper kicking your butt yet, Drake?
I finished air quotes one of them, but because the professor, I submitted it and the professor gives you feedback. A little annoyed by the feedback just because like it's kind of feels like it's, hey, write this whole thing and figure it out. And I'm like, I've never done this before, but okay. So, it's kind of, it sucks a little bit, but I'm hopefully probably I'll sit down tomorrow night and make all of the corrections of the advice that he gave me, and then from there, you know, it is what it is. It's a pass fail course. So
Dude, those are the best courses sometimes.
oh shoot. Cholesterol was week 4, right?
Yeah.
Oxidation and ketones was week 1. Wasn't it? And then biosynthesis was week 2. Blood lipoproteins week 3.
I believe so.
Sounds right.
I think it was like that. Okay, and then these guys. Chapter 6 should be week 6. I'll actually write what they are later. Chapter 7. Chapter 8. 5 is Eicosanoid. Close enough. That's spelled wrong, but that's fine. Biosynthesis. Okay. Thank you guys so much for being here today, for the work you guys put in. Let me know if you guys need anything. Feel free to shoot me a message. And yeah.
Thank you, Drake. We appreciate it.